It's time to start your training routine for hip pain. Exercise 1. Massaging the gluteal muscles. You need a BLACKROLL ball 12 for the first exercise for hip pain. Place the fascia ball on the floor and sit on it with your right buttock. Place your right leg on your left thigh. Move slowly on the spot and take note of any specific tender points. To increase the pressure even more, you can hold your ankle with your left hand. Find a painful spot on this side and keep applying pressure to it for about 15 seconds. Take calm, deep breaths. If you have any problems supporting yourself with your shoulders, put more of your weight onto the ball to take weight off your shoulders. If this is too intense, use a fascia roller instead of the fascia ball first. Roll on it slowly in a circular motion. Put your right leg down and place the ball under your left buttock. Place your left leg on your right thigh. Move slowly on the spot and take note of any specific tender points. Move forward, backwards, sideways, or in a circular motion. If you want to increase the pressure, grab your left ankle with your right hand. Find a painful spot on this side as well. Hold the pressure on this spot for 15 seconds. Don't forget to take a deep breath in and then exhale. Continue to roll. You're almost done. Just 5, 4, 3, 2, 1. Slowly come out of the position. Exercise 2. Massaging the hip flexors. You will need the 12 cm fascia ball again for the next exercise. Lie down on your stomach. Place the ball above your groin, between the top of your hip bone and your straight abdominal muscles. Support yourself loosely with your arms. Let yourself sink down slowly onto the ball. With each breath, you should sink a little deeper into the ball. Relax for about a minute. Be careful when doing this exercise. If you feel any throbbing in your abdomen, you should switch positions. Concentrate on breathing from your abdomen. Work on the other hip flexor by placing the ball on the other side. Let yourself sink down onto the ball. You can get even deeper into the tissue through your breathing. Don't be surprised that you'll be working from the front to begin with. This is important in order to reduce any tension from the shortened muscles and fascia at the front of your body caused by everyday life. Take calm, deep breaths and relax. This exercise is highly recommended, especially after long hours of working in front of the computer. Slowly come out of the position by pushing yourself up using your forearms. Exercise 3. Triggering the lateral pelvis. You need the BLACKROLL Trigger TMX to release deep muscle tension. Stand with your side to the wall and position the trigger tool on the painful spot in your lateral pelvis. Stay in this position and breathe deeply in and out until you feel the pain subside. As soon as the pain subsides, you can slowly move your leg back and forth. This is how you create additional mobilization. Trigger the spot for a total of 3 minutes. Does it seem like the trigger treatment is taking a long time? In order for your body to feel the positive effects, you should linger on a painful point for at least 3 minutes. Try to relax as best you can. To do this, focus on your hips. Just a little longer until you switch sides. Just 30 more seconds. Place the trigger on the other side of your lateral pelvis. Find a painful spot and repeat the treatment on this side. Try to relax as you exhale. You can vary the amount of pressure yourself. Once the pain subsides, you can start to slowly move your leg back and forth. Then linger on that spot for approximately 3 minutes. Taking deep breaths in and out activates your diaphragm and your parasympathetic nervous system. Your body relaxes and tightness eases. Make sure you are practicing conscious abdominal breathing during the exercises. Treatment with the trigger tool promotes blood circulation and helps your tissue to regenerate. In order to be able to release tension in the tissue, oxygen-rich blood must reach the cells faster, and oxygen-depleted blood must be removed more easily. Just 30 more seconds. You're done. Exercise 4. Stretching the hip flexors. You need a BLACKROLL superband for this exercise. Attach the band to an object at hip level. Place the superband around your right thigh from the front. Bring the right leg back. The left leg stays in front. Tense your stomach and buttocks and push your pelvis forward. Place your hands on your left knee. Hold this position for about 1 minute. Let the band pull you deep into the stretch. If you want, you can also do some small rocking movements. Take another deep breath and let yourself fall deeper into the stretch as you exhale. Sit up slowly and switch sides. Slip into the band with your left leg. Bring your left leg back and assume the lunge position. Bring the knee back to the floor. Let the band pull you into the stretch. Make sure you keep your upper body upright. Breathe deeply and fall into the stretch a little further with each exhalation. If you want, you can also do some small rocking movements. The hip flexor muscles are often extremely shortened in people who spend a lot of time sitting. This stretching exercise counteracts this. You're almost done. Just 5, 4, 3, 2, 1. Push yourself back and come out of the position. Exercise 5. Stretching the gluteal muscles. You will need the super band again for this exercise. Leave it in place where it is. Place the super band on the inside around your right thigh. Place the band close to your hip and bring one leg in front of your body, bending your knee to between 45 degrees and 90 degrees. Stretch your left leg out behind your body and press your pelvis toward the floor on that side. If you are unable to assume this position, place a black roll under your right knee. This will make it easier for you to get into the position. To increase the stretch even more, put your forearms on the floor. If you want to go a little deeper into the stretch, lay your head on the back of your hand. Pulling the band pulls your hip joint into the correct position. It also increases the effectiveness of the stretch. It is also possible without a band. Come back up and switch sides in 5, 4, 3, 2, 1. Position the band around your left thigh. Bring one leg in front of your body and bend your knee to between 45 degrees and 90 degrees. Stretch your right leg out behind your body and press your pelvis toward the floor on that side. Place your forearms on the floor if that's possible for you. Otherwise, stay where you are. Take a deep breath in and out. If you can, lay your head on the back of your hand. Slowly return to the starting position. Exercise 6. Activating the external hip rotators. You need a black roll loop band for this first strengthening exercise. Pull the band over your legs and position it above your knees. Lie down on your right side and bend your hips to about 45 degrees. Raise your top thigh and rotate it outward. Then return to the starting position. Repeat this 10 times. 5, 6, 7, 8, 9, 10. Slowly switch to the left side and do 10 repetitions here as well. Make sure that the inner edges of your feet remain on top of each other. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a short break before we continue with the other side again. Return to the starting position. Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch sides and do another 10 repetitions here as well. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take another quick break before starting the last set. Get ready and switch sides again. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. One last time switching sides and then you're done. One, 2, 3, 4, 5, 6, 7, 8, 9, 10. Just 2 more exercises. Exercise 7. Single leg pelvic lift. You need a BLACKROLL ball 8 for this next exercise. Lie down on your back and bend your knee to about 90 degrees. Place the ball between your right thigh and your lower abdomen. Draw your knee on that side firmly toward your upper body and tuck the ball against your body. Lift your buttocks off the floor, push your arms onto the floor and stretch your hips up. And then come back down, but don't rest your pelvis down completely. Repeat this 10 times. Five, 6, 7, 8, 9, 10. Tuck the ball into your left side and repeat the steps. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Take a short break. We're going to do a total of 3 sets per side. Place the ball on your right side and get ready, and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch the ball to your left side and start the repetitions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Let's take a break. Take deep breaths in and out and relax. Get ready, tuck the ball into your right side one last time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Switch one more time to the left side. You're almost done. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You're done. Exercise 8, single leg squats. It's best to sit on a chair for the next exercise. Stand up and shift your weight onto your right leg. The left leg stays floating in the air. Try to get up from the chair this way and sit down again. Repeat this 10 more times. 6, 7, 8, 9, 10. Time to switch sides. Place your weight on your left leg. 4, 5, 6, 7, 8, 9, 10. Take a short break. If it's hard for you to stand back up again with one leg, lower yourself down on one leg in a controlled manner. Then use both your legs to push back into the starting position. You're about to see how it's done. Get ready. Here we go. 4, 5, 6, 7, 8, 9, 10. Time to switch sides. Shift your weight back onto your left leg. 4, 5, 6, 7, 8, 9, 10. Take another deep breath. Shake out your feet and move on to the last set. Ready? Here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Time to switch sides. Shift your weight back onto your left leg. 2, 3, 4, 5, 6, 7, 8, 9, 10. You worked hard. If you perform these exercises 2 to 3 times a week, your pain should subside soon. We hope you feel better soon. See you next time.